Welcome back to Mission Brains podcast, where we explore the frontiers of neuroscience, neurology, and neurosurgery around the world. I'm Ziwe.
I'm Carla, and today we're diving into a topic that's both challenging and inspiring: neurosurgery in low and middle income countries. Why it matters, what obstacles exist, and how innovation is reshaping the field.
Imagine this scenario, Carla. A child in rural Nepal falls from a tree and suffers a severe head injury. In a high-income country, she might be rushed to a neurosurgical center within the hour, scanned, operated on, and closely monitored in the ICU. But in many low-resource settings, specialized neurosurgeons are few and far between. MRI scanners might be available only in the capital city, and ICU care is limited or non-existent.
Oh, I can imagine this delay or lack of care can be fatal. Tragically, neurological conditions like traumatic brain injuries, hydrocephalia, brain tumors, and epilepsy affect millions of people in these regions. Yet access to effective treatment is strikingly unequal. So, why does this delay exist?
Well, the shortage of trained neurosurgeons is staggering. Some countries in sub-Saharan Africa have fewer than one surgeon per million people, compared to 50 or more per million in parts of Europe.
Also, hospitals may lack basic surgical tools or imaging technology, and postoperative care can be minimal. Even when surgery is technically possible, factors like electricity shortages, limited sterilization facilities, or lack of trained nursing staff can make outcomes uncertain.
Yes, these are challenges that developing countries are facing, but let's focus on the solutions. Take telemedicine, for example. Surgeons in high-resource countries can now guide complex procedures remotely, using real-time video and imaging to advise local teams. In Ethiopia, for example, neurosurgeons from Ohio State University's Wexner Medical Center have partnered with local hospitals to provide both training and case guidance, helping local teams perform safer and more effective surgeries.
Oh, technology is playing a huge role too. For example, in Ghana, AI-powered imaging tools are being developed to detect brain tumors and other neurological conditions with limited quality MRI scans. For example, in Nepal, augmented reality assisted surgery has been piloted to improve the placement of ventriculostomy catheters, reducing complications and saving lives. These innovations aren't just high-tech experiments. They're tailored to the realities of hospital that may lack full ICU support, high-end imaging, or even consistent electricity.
Additionally, education and capacity building are equally crucial. Global neurosurgery initiatives and foundations like Mission Brain focus on training local doctors, nurses, and surgical staff so the knowledge stays worldwide, including educating and empowering medical students. For example, Vanderbilt University Medical Center has programs linking faculty and residents with hospitals across Africa and Asia, providing mentorship, hands-on training, and structured programs to build long-term neurosurgical capacity. Over time, these partnerships don't just treat patients, they create sustainable healthcare systems capable of training future generations of neurosurgeons.
And that's exactly where Mission Brain comes in. It was founded by Dr. Alfredo Quiñones Hinojosa and Dr. Michael Lawton to expand access to neurosurgical care in underserved communities. The foundation not only provides free surgeries during medical missions, but also trains local teams, supports research, and builds sustainable networks so that expertise continue to grow after each mission. And there's another layer. Research in sub-Saharan Africa, collaborative studies are now using deep learning frameworks to improve brain tumor diagnosis from MRIs, even when images are low quality or radiology expertise is limited. Federated learning models are being tested to train AI across multiple hospitals without sharing sensitive patient data. These projects aren't just academic, they directly improve patient care by bringing diagnostics closer to rural communities. But what's the big takeaway?
The big takeaway is that advancing neurosurgery in resource-limited settings is about more than just performing surgery. It's about creating systems where training, technology, infrastructure, and research work together. It's about empowering local teams, innovating in ways that make sense for the environment, and fostering collaborations that are sustainable, not temporary. It's about giving a child in rural Nepal or anywhere else the chance at the same secured life-saving care in wealthier countries.
So, when we talk about neurosurgery, we're talking about hope, ingenuity, and resilience. From AI assisted imaging to telemedicine consultations, from augmented reality guided surgery to international training programs, every innovation is a step forward as a future where quality neurosurgical care is truly global.
And that's all for today's episode of Neuronotes.
We hope to see you again for our coming interview for deeper insights on global neurosurgery with Dr. Key B. Park, the co-director of Mass General Brigham Global Neurosurgery, the director for Policy and Advocacy Program in Global Neurosurgery and Social Change, and the Korea Health Policy Project at Harvard Medical School, and the editor-in-chief at the Journal of Global Neurosurgery.
Thank you for joining us today, and more exciting discussions will be coming soon.